Hello and welcome to our channel. In today's video, we will explore cancer, one of the most researched diseases worldwide, affecting millions of people. Cancer is a serious health issue that occurs when cells grow and multiply uncontrollably. So, what is cancer? Typically, the cells in our body grow, divide, and die in an orderly manner. However, cancer disrupts this order. Cells begin to multiply uncontrollably and may invade healthy tissues, forming tumors. These tumors can be benign or malignant. Benign tumors are usually not dangerous, but malignant tumors can spread to other parts of the body and damage vital organs. Cancer is encountered globally, with approximately 18 million new cases each year, and this number continues to rise. Around 9.6 million people die annually from cancer-related causes. This disease can significantly impact the quality of life, and if left untreated, it can be fatal. Cancer is as old as human history itself. Traces of cancer have been found in the bones of mummies in Egypt. With the advancement of modern medicine, we now understand cancer better and have developed various treatment methods, but much research is still needed to fully understand and treat this complex disease. What are the symptoms of cancer? The symptoms can vary significantly depending on the type of cancer, its location, and the extent of its spread. However, some general symptoms are common to many types of cancer. For instance, unexplained weight loss can be a warning sign of cancers like stomach, pancreas, esophagus, and lung cancer. Chronic fatigue, which doesn't improve with rest, is often seen in leukemia or colon cancer. Non-healing wounds, especially in areas with a high concentration of cancerous cells, could be a sign of skin cancer. The symptoms can become more specific, depending on the type of cancer. For example, lung cancer might present with a persistent cough, bloody phlegm, and shortness of breath. In breast cancer, symptoms may include a lump felt in the breast or underarm, nipple discharge, or changes in the shape or size of the breast. In prostate cancer, symptoms may include difficulty urinating, blood in the urine, and pain in the groin area. So, what causes cancer? There is no single cause of cancer. It can be caused by genetic factors, environmental influences, lifestyle choices, and certain infections. Cancer often occurs due to damage or mutations in a cell's DNA. Some people have a genetic predisposition to cancer, such as mutations in the BRCA1 and BRCA2 genes, which increase the risk of developing breast and ovarian cancer. If multiple cases of cancer are seen in a family, this could indicate a genetic predisposition. Environmental exposures also play a significant role in increasing cancer risk. For example, long-term exposure to chemicals like asbestos, benzene, and formaldehyde can increase the risk of cancer. Exposure to radiation, such as X-rays or UV rays, can cause DNA damage, increasing cancer risk. Prolonged exposure to UV rays in particular can lead to skin cancer. Lifestyle choices can significantly affect cancer risk as well. Smoking is the leading cause of lung cancer and is also linked to cancers of the mouth, throat, pancreas, and kidneys. Diet plays a crucial role too. For instance, the consumption of red and processed meats, high-fat diets, and insufficient fruit and vegetable intake can increase cancer risk. Excessive alcohol use increases the risk of liver, mouth, throat, and breast cancer. Additionally, regular physical activity can have a protective effect against some types of cancer. Lack of physical activity can lead to obesity, which can pave the way for cancer. Infections are another factor that can contribute to cancer. For example, HPV, human papillomavirus, is considered the main cause of cervical cancer. Hepatitis B and C viruses can lead to liver cancer, and the bacterium Helicobacter pylori can cause stomach cancer. Diagnosing cancer can be a complex process and involves various methods. Early diagnosis broadens treatment options and improves the patient's quality of life. Diagnosis typically begins with a physical examination by a doctor, who evaluates the signs and symptoms, may feel for tumors or abnormal masses, and can order tests as needed. Imaging plays a crucial role in diagnosing cancer and assessing its spread. Techniques like X-ray, mammography, ultrasound, MRI, and CT scans help detect and evaluate the extent of cancer. A biopsy is one of the most important methods for confirming a cancer diagnosis. Suspicious tissue or cell samples are taken and examined under a microscope to determine if they are cancerous. So, what treatment methods are applied? Surgery is one of the most common and oldest methods of cancer treatment. Depending on the location of the cancer, the surgeon tries to remove the tumor along with a piece of surrounding healthy tissue. For example, in breast cancer, a procedure called a lumpectomy may be performed to remove only the tumor, or a mastectomy may be performed to remove all breast tissue. In prostate cancer, part or all of the prostate may be surgically removed. Surgery alone may sometimes be sufficient, but it is often used in combination with other treatments such as chemotherapy or radiation therapy. Chemotherapy is a treatment method that uses drugs to kill cancer cells or stop their growth. These drugs target rapidly dividing cells in the body, helping to stop the growth of cancer cells. Chemotherapy can be used in various ways, such as neoadjuvant therapy to shrink a tumor before surgery or as adjuvant therapy after surgery to eliminate any remaining cancer cells. Side effects of chemotherapy can include hair loss, nausea, fatigue, and an increased risk of infection, as it can also affect healthy cells that divide rapidly. Radiation therapy uses high-energy radiation to kill or shrink cancerous cells. It damages the DNA of cancer cells, stopping their division and growth. Radiation therapy is usually administered externally, but can also be applied internally through brachytherapy. It's commonly used in localized cancers like prostate cancer or brain tumors to shrink the tumor or control cancer growth. The side effects of radiation therapy vary depending on the area being treated, but may include skin redness, fatigue, and tissue damage in the treated area. However, modern radiation therapy techniques use advanced targeting methods to minimize damage to healthy tissues. How can we prevent cancer? One of the best ways to prevent cancer is to adopt a healthy lifestyle. This minimizes the risk factors that can lead to the development of cancer in the body. A balanced diet rich in antioxidants, vitamins, and minerals can reduce cancer risk. A diet that includes plenty of fruits, vegetables, whole grains, and healthy fats is particularly recommended. Avoiding smoking and limiting alcohol consumption is crucial, as smoking can cause various types of cancer, primarily lung cancer, while alcohol increases the risk of liver, mouth, and throat cancers. Regular physical activity plays a significant role in reducing cancer risk. Engaging in at least 150 minutes of moderate physical activity per week can particularly reduce the risk of colon and breast cancer. Additionally, regular screening tests for certain types of cancer can help detect the disease in its early stages, increasing treatment options and improving survival rates. Stress management and psychological support are also important. While there is no clear evidence that stress directly causes cancer, long-term stress can weaken the immune system and lead to unhealthy behaviors. Therefore, practicing stress management techniques such as yoga, meditation, and regular exercise can help keep stress levels under control, contributing to overall well-being. In this video, we have detailed what cancer is, how it occurs, its symptoms, causes, and risk factors, the diagnosis process, treatment methods, and ways to prevent it. Remember, life is better when you are healthy. Take care of yourselves and stay healthy.